I truly believe that we're about optimal child development. Every child enters into this life at a different stage, and we provide those supports and those partnerships that really help that baby thrive. And we help the family thrive, and we help the community thrive. So it's really trying to bring out the best in them and their family.
Language acquisition happens between the ages of 0 and 3. That's when the brain learns the fastest. When a child can't hear, if they have chronic ear infections where their hearing is going back and forth, you see a lot of speech delay, and then when they can't communicate, there's a lot of tantruming and a lot of problems in the family. If they get behind between 0 and 3, it's a lot harder for them to catch up. So if we don't catch a child who has a hearing loss early, they become more delayed, and it actually causes them more problems in the long run. We're catching kids really early. We have newborn hearing screening is mandatory in all 50 states now, and if they have a hearing loss, the TLC has been able to step in with different services. We have a parent-infant program where a parent actually works directly with an advisor in the home to teach them how to communicate with their babies. This early intervention is the best in the state. This is the best that I've seen.
A child, as it develops, is going to need to sense its environment. As you might imagine, if you can't see, how comfortable do you feel walking or crawling or interacting with the parents you have? So there's so much emphasis put into a vision development and checking a child's vision. So if a child comes in and let's say one of the eyes has something blocking the pupil, it could be a cataract, it could be a tumor, it could be something like a scar, glaucoma, some kind of developmental abnormality. Those kind of things need to be dealt with really promptly, otherwise a child doesn't develop normal vision. And then if a child doesn't develop normal vision, they'll have issues with things like walking and crawling and getting around. There's even good evidence to suggest that kids who have troubles with their vision will, although that may not be severely impaired, like they may walk and run and play, they can have troubles learning to read, and that can be a huge burden. So we always try to maximize a child's vision early on in life so that they can develop those things and live a very healthy, productive life.
TLC provides the opportunity for families that are enrolled to come here to our clinic for oral health services, specifically dental hygiene services. And so once they provide that opportunity to not only the children, but to the families that support those children, moms and dads, brothers and sisters who may not be a child enrolled in a TLC are also welcome to come to this clinic. So once they arrive here, TLC provides translators, they provide babysitters if needed, if parents are getting care, and then we provide the dental hygiene services. Along with that, there's always one or two volunteer dentists who come from the community who provide assessments or examinations and recommendations for that care that those patients may need. So those patients arrive, and the dental hygiene students take radiographs or x-rays, and they do a full assessment, and then we provide dental hygiene services such as cleanings, fluoride treatments, etc. If the patient has needs beyond the scope of this clinic that we can complete, we then allow them to come back to our clinic for free to continue dental hygiene care, such as deep cleanings and so forth.
My biggest passion is to make sure that children have the opportunity to have health. And I see health as like a big circle, so many different aspects of it. You've got vision, you've got hearing, you've got dental, you have mental health, you have the child being able to, see their doctor to get the medical care that they need. And so my role here is to help ensure that every child has that opportunity to really thrive, to be healthy. And lots of families don't understand the importance of those moments in life. If you are not healthy, or your teeth hurt, or you have ear infections, the huge impact of that on them. And so it's really the role of myself and then our home visitors to educate the families on those things and help support them. We partner with many people in the community to get this done, because obviously we're not doing a lot of the services here in-house. We're just ensuring that the families can get those services done.
So I'm in a really fortunate position where I have 84 staff, and every day I hear story after story about the impacts that we make in families' lives. So we serve about 600 families a week, and the beauty of serving 600 families is that we have 600 amazing stories that we can tell about how we've helped to change the lives of children, how we've helped to change the trajectory for them and their families. And so staff get to witness that on a daily basis, and it really changes the trajectory of a child's life for the better, and it can change it forever.